And, there's a analogous comparable task in adults in terms of return to work. So, so much focus on sport concussion has been on return to play because the risk involved with it. But return to learn is really probably the main vocation of, all of our kids. And one of the big additions to the return to learn and return to play process that was recommended was that really return to play shouldn't occur if return to learn hasn't occurred. And so that's really an essential piece that's important to remember. And then along those lines, recognizing that that happens in a gradual fashion, but also the sooner we get kids back into that setting supported, the better they do also. That we don't want to have them out of learning for too long, simply because, again, with your brain, use it or lose it. And even if you can't do everything cognitively or physically, you should be doing something. And that applies to both thinking as well as the aerobic exercise, which, was another addition in terms of the return to play, that before you get to full return to learn or full return to play, you'll have, return to learn with supports and modifications, and you'll have, return to activity or aerobic exercise that's not risk, bearing. And those are both important stages in getting you back, and not just saying, you flip a switch, oh, you're injured, and then you give it like X amount of magical time, and then you flip the switch, and then all of a sudden you're ready to go back to everything. The brain just doesn't work that way. And it's the same with, a pulled muscle or a high ankle sprain or any of those things, which is why we have found that, PTs, OTs have always been such great partners, because you understand that gradual return, because that's what you do with everything, and that's what we do in sports medicine, and I think that really applies to the brain as well.